हाय, मेरा नाम वैशाली पंचाल है। मैं वडोदरा गुजरात से हूँ। मुझे लंग्स में प्रॉब्लम हो गया था। मैं सांस नहीं ले पा रही थी ज़्यादा और थक जाती थी बहुत, और मुझे खांसी भी बहुत रहती थी। तो हमारे बड़ौदा के डॉक्टर सोनिया दलाल से हम मिले। फिर उन्होंने हमको यहाँ का हैदराबाद का यशोदा हॉस्पिटल का रेफरेंस दिया डॉक्टर विश्वेश्वरन के साथ। फिर हम यहाँ पे आए। डॉक्टर विश्वेश्वरन सर ने हमको ट्रीट किया। फिर उन्होंने सब करके देखा तो उन्होंने बोला कि ऑपरेशन करना पड़ेगा। फिर मेरा ऑपरेशन किया डॉक्टर बाला सुब्रमण्यम। उन्होंने मेरा लंग्स का ऑपरेशन किया। नाव मैं बहुत अच्छी ठीक फील कर रही हूँ। मुझे बहुत अच्छा लग रहा है। अभी मैं कंप्लीट ब्रीथ कर रही हूँ और अच्छे से चल रही हूँ। और मैं अभी मुझे जो प्रॉब्लम्स थी वो एकदम कम हो गई है। लगता है कुछ हुआ ही नहीं है। एंड आई एम सो हैप्पी टू यहाँ आके मैं बहुत खुश हूँ कि मुझे यशोदा हॉस्पिटल में आके इतना अच्छा ट्रीटमेंट मिला। और थैंक यू डॉक्टर विश्वेश्वरन सर एंड थैंक यू डॉक्टर बाला सुब्रमण्यम सर, जिनकी वजह से आज मैं यहाँ पे अच्छी होकर रही हूँ। और थैंक्स टू माय मैडम डॉक्टर सोनिया दलाल मैडम, जिन्होंने मुझे इतना अच्छा हॉस्पिटल एंड डॉक्टर सजेस्ट किए। थैंक यू सो मच।
Hello friends, I am Dr. Vishweshwaran. I am working as a consultant interventional pulmonologist at Yashoda hospitals in Hyderabad. We have this patient, Mrs. Vaishali Panchal. She was referred to us all the way from Gujarat for complaints of fluid inside the chest, which we refer to as a pleural effusion. So this patient was suffering for almost 3 to 4 months. Initially she complained of pain in the chest, for which she was evaluated in Gujarat, and at that time they did an ultrasound chest and they found out that there was fluid inside the pleural space. So they had tried to remove the pleural fluid and sent for all the analysis, but unfortunately despite extensive testing all the reports came inconclusive. In addition to this, the patient was then subjected to advanced procedures like bronchoscopy and endobronchial ultrasound in Gujarat, but despite that a proper diagnosis could not be made. So in due course the patient condition deteriorated and the fluid which is present inside the pleura, that is inside the chest wall, became much thickened and it almost became a pus. So that is the condition at which the patient was then referred to us at Yashoda hospitals in Hyderabad. So upon presentation to us, the patient was having a lot of pus inside her chest. So we decided to take the patient directly for a surgery, and our CT thoracic surgeon Dr. Balasubramanian did a excellent surgery where they have removed all the pus from the chest, and along with that post surgery the lung has now completely expanded, and the patient and the tubes that were put inside the chest were also subsequently removed within 3 to 4 days, and now the patient is fit for discharge. And luckily this time during the biopsy of the chest wall, which was done during the time of the operation, suggested tuberculosis. So right now we have started this patient on tuberculosis medicine and the patient is showing amazing results. So it is very important that whenever you have such fluid inside the chest, that needs to be properly evaluated, and in this case that luckily it turned out to be a tuberculosis. In multiple instances such undiagnosed pleural effusion can be a manifestation of an underlying cancer. So these requires proper evaluation, and in Yashoda we have the advanced facilities including surgeons assistants to arrive at diagnosis early and treat the patient in a proper way. Thank you.
Hi everyone, I am Dr. Bala Subramaniam. I am the consultant thoracic surgeon. We had an opportunity to operate on Mrs. Panchal Vaishali, who had come all the way from Vadodara in Gujarat. She had complications of tuberculosis in her lungs, causing shrinkage of her lungs and also accumulation of fluid around her lungs. So we managed her surgically by video assisted thoracic surgery, or VATS decortication, where we may basically make 3 holes, one for the camera and 2 for 2 instruments, and we go into the chest cavity. We suck out all that bad purulent fluid, and we get the lung re-expanded back up. So she made a very fantastic uneventful recovery, and she was then discharged from hospital by around the fifth day. So video assisted thoracic surgery has all the advantages of a minimally invasive surgical procedure, where your recovery is pretty fast. It's a minimally invasive procedure, so you will only have 1 centimeter or 5 millimeter holes through which small instruments are inserted, and we do the same procedure as we do in an open surgery. The advantages are, because your ports are small, the chances of an infection is less, the chance of having pain is minimal, and your recovery is altogether faster. So we are happy to know that she is already functional. She is fully functional, and she has returned to her normal life in 2 weeks after the surgery is over.